contact with blood or other secretions from the patient. That's why even in Liberia, or where it's worst affected, what we're seeing is it's healthcare providers who are handling secretions, or it's close family members handling secretions, or those who unfortunately have to bury the dead and come into the secretion. So this is not something that's going to be easily transmitted, and that's why I have a lot of optimism with the CDC and the State Health Department identifying any potential case contacts, that this will be controlled and would not lead to an epidemic in the Dallas area.
Dr. Hotez, stand by for one moment. I want to bring in Dr. Amy Ray, infectious disease specialist with the University Hospitals Case Medical Center.
Thank you for having me.
Thank you. 4 days without being tested, doctor. Tell me how you respond to that, what concerns and questions are raised when you hear that.
Well, I think first and foremost, the epidemiologic history of the patient has to be obtained by the medical care providers. Many hospitals in the United States have already taken care of ill travelers returning home from West Africa with fever, my hospital included. So the very first step is understanding where the patient has been, when they had traveled, when they returned, and when they became symptomatic. I'm not aware of the details of this particular case in Texas, but it's certainly not a surprise to me that a case has been diagnosed in the United States.
Dr. Hotez, let me ask you this. They knew when he arrived in the United States that he had come from Liberia. Don't you think that they should have been more aggressive and harder when he first started showing symptoms? Why wait the 4 days when they knew of the Ebola outbreak in the area of the world that he had just come in from?
Well, again, this is a disease that's not going to be transmitted unless you're sick at the time. So presumably when he came into the United States, he was not having a fever, showing no signs and symptoms of the infection, and he was at zero risk. What we don't know is what happened after he developed fever, knew he was sick, and we don't have a lot of details of what happened in the next day or two before he sought medical attention. And we'll learn more about that in the coming days and weeks as well as we follow this patient.
And that's what concerns me, doctor, is that if it took several days, 3 or 4 days before they could diagnose him, how do we know, or how do we tell the public that they would know that there may be some concern that they ought to check out? To Dr. Ray.
Well, again, sorry.
Oh, no, that's okay. Well, again, the details remain to be seen. So depending upon how far he was into his illness upon presentation to the hospital and what their index of suspicion was for Ebola, there are many different infections that can be acquired as a result of travel. So we have to get the timeline and the contacts and the basics of public health nailed down before widespread panic should ensue, for sure.
All right, Dr. Hotez and Dr. Ray, thank you both for your time.
Thank you, Reverend.
Thanks, for all the best.
We're going to have much more on this breaking news story. The first confirmed case of Ebola in the U.S., including a press conference from that hospital in Dallas where the patient is. And also breaking news on the intruder who carried a knife into the White House. Both stories are breaking. We'll have them both ahead.
Introducing Dance All You Want Bladder Leak Protection from the experts in feminine protection. New Always Discreet underwear for sensitive bladders. Absorbs heavy leaks faster than the leading brand, so you can feel comfortably dry. Plus, a discreet fit that hugs your curves. You barely feel it. New Always Discreet. Now bladder leaks can feel like no big deal. Because, hey, pee happens. Visit alwaysdiscreet.com for coupons and your free sample.
The new Joseph A. Bank Traveler Slim Fit Suit. A modern fit in all natural stretch wool. And a new generation of style, quality, and suit value for just $295. Narrower lapels, trimmer cut jackets, and plain front pants with narrower legs. The Slim Fit Traveler Suit. With or without a tie, the best $295 Slim Fit suit value in America, period. We're making it work at Joseph.
Now we can record all my shows, your shows.
And their shows?
Yep, at the same time. And we can pause TV here and play the rest here.
Why don't we watch TV in the treehouse?
Have a doghouse.
I don't think so. What are you doing, Uncle Craig? You need to go to bed.
It's time for Fios Quantum TV. Record up to 12 shows at once. Store up to 200 hours in HD. Plus, watch live TV on the go with the Fios mobile app. Redefining what TV can be.
I'm Elizabeth Esty, and I approve the message.
You paid into it every paycheck. But Mark Greenberg would end Social Security's guarantee.
It's a failure. Social Security is a failure as far as I'm concerned. You got to rely upon your own system of retirement, your self-retirement system, and not the Social Security system. In that case, you're off the public dole. Social Security is a failure as far as I'm concerned.
Now to the breaking news on our other top story, the White House intruder. Late today, as lawmakers grilled the Secret Service director, yet another bombshell report about what happened inside the executive mansion. The Washington Post reporting the intruder was tackled by an off-duty Secret Service agent who coincidentally in the house and leaving for the night. Quote, he happened to be walking through the house when chaos broke out and the intruder dashed through the main foyer. It's amazing. Every day chilling new details are emerging. Here's the state floor of the White House. Remember, the Secret Service initially said the intruder had been apprehended at the main entrance. But then we learned the intruder made it through the East Room, all the way to the doorway of the Green Room. And today, we're learning he was stopped there by sheer dumb luck, an off-duty officer. Of course, lawmakers questioning the Secret Service director today didn't yet know about these details, but they knew enough to ask some very tough questions.
We must learn whether today's Secret Service, as structured, for example, 5 or 6 fence jumpers.
After allowing a paparazzi-crazed reality TV star to crash a state dinner,
someone should be held accountable. Don't let somebody get close to the president. Don't let somebody get close to his family. Don't let them get in the White House, ever.
This is beyond the pale. And I've listened to your testimony very deliberately here this morning. And I wish to God you protected the White House like you're protecting your reputation here today.
Yes, sir, if I may. Anytime, any organization, you start to make significant changes, some people will have resistance.
The Secret Service was under a microscope today. The focus could be about to get even more intense. Joining me now is Congressman Stephen Lynch, who serves on the House Oversight Committee and was in that hearing today. And Jack Rice, a former CIA agent who spent time as a special agent in its Office of Security. Thank you both for joining me.
Thank you, Reverend.
Congressman, before we talk about the hearing, what's your reaction to this new report about an off-duty officer was the one that stopped this intruder?
Well, it's basically accurate, Reverend. The officer who actually ultimately stopped the intruder, there were 2 officers involved, but I think the one that made the difference was actually just finishing up paperwork downstairs and heard the commotion upstairs. So you're right to ask, what would have happened if this officer just, we got lucky. This officer was coming off duty at the time that the intruder came through, and that was how he was stopped. So it raises a lot of questions.
But Jack, I mean, let's look at more detail from the Washington Post story. It says there's no telling how long this guy could have run around if the detail guy hadn't happened to be there, one person said.